Hey guys, James here again from Vitality Chiropractic Australia. I've been on a bit of a recent crusade to try to hunt down some research for a client of mine. Bit of background information: this client of mine, she has a family member who is a physiotherapist, and she's explaining that she's been seeing a chiropractor, she's been having some neck pain, and that she's seen some really good results. The physiotherapist has recommended or tried to persuade her to not continue her chiropractic care and in fact see a physiotherapist instead. The rationale behind their recommendation was that seeing a chiropractor wasn't safe, and that potential implications may come about from having your cervical spine on your neck manipulated. So I've been on a hunt for some appropriate research to give to this client of mine to demonstrate, to show her and her family member that seeing a chiropractor is safe. Chiropractors are thorough. We're primary healthcare practitioners. We have fantastic education, and when someone is thoroughly assessed in a comprehensive manner, the risks involved with treatment are extremely small. So I wanted to show you this publication which I found. This is a 2006 paper. It's in the Chiropractic and Osteopathy Journal. It's titled "Inappropriate Use of the Title Chiropractor and Term Chiropractic Manipulation in the Peer-Reviewed Biomedical Literature." It's authored by Adrian Wenburn. Some of the things which he goes on to say, which I've highlighted, I'm going to read to you. So essentially, what this guy did was, Adrian, he went back across a 12-month period and reviewed all of the literature which was consistent with using the term chiropractors and chiropractic manipulation of the cervical spine. He found that there were 6 separate publications which had a total of 24 different cases. So, let's quote. "In each of the 6 publications, the authors suggest that care or treatment was provided by a chiropractor, and that each patient received chiropractic manipulation of the cervical spine." Okay? Now, upon questioning, Adrian has found that the principal researchers revealed that care was in fact not provided by chiropractors, but in their research they've written the care was provided by chiropractors. So this is part of the image which the bad image that the chiropractic profession gets, is because researchers are pumping out this research saying an injury was caused by a chiropractor, the chiropractor performed manipulation of the neck. Adrian's been able to demonstrate through his publication that the treatment wasn't in fact delivered by a chiropractor, it was delivered by someone else. So just to recap, seeing a chiropractor is safe. Okay? Next point. Let's continue reading. The principal researcher conceded that the term chiropractor had been inappropriately used, and that the case series did not relate to chiropractors who had undergone appropriate formal training. The author of the secondary report, a British medical journal editor, conceded that he had misused the title chiropractor. So, just further evidence that the bad image that chiropractors are getting is being started through research articles. People misusing the term chiropractors when in fact it's not a chiropractor who's delivering the treatment at all. In the conclusion, Adrian says the words chiropractor and chiropractic manipulation are often used inappropriately. Next point, when reporting apparent associations between cervical spine manipulation and symptoms suggestive of traumatic injury. So basically what he's saying is that when there's a case of someone who's had an adverse reaction to having their neck manipulated, it's not chiropractors who are behind the injury or who is the treating practitioner. It's someone else. Someone who doesn't have adequate training in what they're doing. Additionally, further preliminary evidence beyond that already provided by Alan Terrett that the inappropriate use of the title chiropractor and term chiropractic manipulation may be a significant source of over-reporting of the link between the care provided by chiropractors and injury. So that's, guys, I just wanted to give you a bit of background that seeing chiropractor is certainly safe when it's done properly. Okay, your practitioner needs to be thorough. They need to perform a comprehensive assessment. If there's any potential risk factors to you receiving treatment, we will not administer any treatment. Okay, so it's not dangerous to see a chiropractor. This publication suggests that it's in fact dangerous seeing other professionals. You know, whether it's a Chinese massage therapist who's trying to adjust your neck. You know, I don't want to slander any other professions, but that's just an example. So I hope you found this video helpful, guys, and I wish you all have a great afternoon.